Hawaiians have a olelo no'eau, ilohe ka olelo a ho'oko, eola aua ne'i a laupa'i. One who hears good counsel and heeds it will live to see many descendants. And today, I receive good counsel to continue to wear my mask, to avoid large gatherings, and to get vaccinated to reduce the spread of COVID-19 in our communities. The consequences of this pandemic are devastating, and we must take action now to protect our future. It is my sincere hope that the generations that come long after us know that we did everything possible to remain standing as a lahui. I am here today because I want them to thrive. And this is why we are here today, so that we thrive.
As an educator, I also worry that the residue of our current situation will negatively affect the hearts and minds of our haumana and our keiki. Please do not breed distrust for our healthcare workers and the medical field in our communities. Don't place doubt in their hearts and minds, in the hearts and minds of our children, for those that are ready to save our lives. As a teacher and now the principal of a Hawaiian-focused charter school in Nanakuli, we encourage our students to embrace education as important. We have guided them to kulia and become doctors, nurses, and lawyers and such, if they choose. And in this context, after all of our encouragement and all of their hard work to get there, we seemingly have turned our backs on our native Hawaiian doctors. Please find them in your communities and raise them up as your leaders. Let their knowledge and experience guide us in troubled times.
And we are all here today as Hawaiians because this current COVID-19 Delta surge is us. Native Hawaiians represent the largest percentage of infections in this wave. And if we don't take action now, we will represent the largest percentage of deaths. We cannot allow that to happen. As we convene here today in the presence of our Queen, Lili'uokalani, I've been thinking for the last couple of days about her life and what she went through as Queen of our people. During the Queen's lifetime, the Native Hawaiian population went from 140,000 individuals at the time of her birth in 1838 to 40,000 individuals at the time of her death in 1917. A 70% drop. So I thought about that and what kind of impact that had on her life and what it would have been like to live through a time where 70% of her community vanished. Almost all due to diseases that today are curable: smallpox, measles, whooping cough, influenza.
And so what can Hawaiians do about this? It was shared. Wearing the face mask, keep maintaining the distance. And so I would say, from Queens, to mirror what others said, this surge is for real. Get vaccinated, stay home, and the reminder that Queens is there to care for you. Mahalo.